To determine the proper size, 3 circumferential measurements are required. Xiphoid or chest, measuring 1 inch below the tip of the breastbone. The umbilicus or waist, and greater trochanter or fullest contour of the hips. To prepare for application, position the patient on their side. To do so, bend the knee of one leg to a 90-degree angle while keeping the other leg straight. Place the patient's arm overhead by their ear. Place the patient's other hand on their abdomen. To turn the patient onto their side, reach across the patient and grasp the draw sheet. On the count of 3, pull the draw sheet toward you, rotating the patient to their side. Pull the draw sheet slowly, monitoring the patient for comfort and preventing any rotation of the spine. To apply the orthosis, tuck or slide the closure under the patient's lower back so that it can be retrieved on the other side. The inferior or lower portion of the posterior panel should be positioned just above the coccyx. Next, roll the patient back into the supine position. Place the anterior or front panel in the proper position 1 inch above the pubic bone. Ensure the dial on each side of the orthosis is disengaged by pulling out on the dial. Secure the side closure attachments by applying them to the anterior front panel. First on the left side, then on the right. On each of the side closure attachments, locate the dial and push in to engage. Turn both dials clockwise to tighten laces. After ensuring that the anterior panel is in the correct position, you can repeat the tightening process. Keeping the patient's legs together, gently bend their knees, monitoring the patient for pain. Position the patient's arm extended overhead with the elbow straight on the side on which they will be turned. Assist the patient to a seated position. The goal is to keep the shoulders squarely over the pelvis as the patient is being transferred. Once the patient is positioned, recheck the positioning of the anterior and posterior panels. If using the DLE, follow the application steps to apply the TLSO orthosis. Before rolling the patient into a supine position, secure the DLE to the back of the brace with the hook closure. Bring the DLE strap and pad over the top of the shoulder and back under the arm. Clip to the matching piece on the posterior section. Release the click buckle closure. Clip the other strap to the posterior section on the opposite side and slide beneath the patient. Roll the patient onto their back. Retrieve the other strap and pad and secure the click buckle closure. If using the SPK, follow the application steps to apply the TLSO orthosis. Before rolling the patient into a supine position, secure the posterior thoracic extension piece of the product to the back of the brace with hook closure. Once positioned, make sure the straps can be retrieved before rolling the patient into the supine position. To attach the sternal pad bar, begin by opening the 4 closures on the front of the orthosis. Remove the plastic anterior insert. Slide the sternal pad bar into the notched section of the anterior insert. Position the insert over the anterior fabric as if it were inserted inside the panel. Next, determine the length of the sternal pad bar. The center of the superior edge of the sternal pad bar should be 1 to 2 inches below the sternal notch. After the proper length is determined, use the 2 screws included to secure the sternal pad bar to the anterior plastic insert. To create a more comfortable fit to the patient's chest area, use the bed to contour the sternal pad bar, then contour the metal on the pad. Insert the anterior plastic with the attached sternal pad bar back into the anterior panel. Once the sternal pad bar and posterior thoracic extension are positioned, secure the 4 closures to close the front panel pocket. Next, pass the posterior thoracic extension straps through the chafes. Trim any excess strapping, then attach the removable hooks and secure.